and that it's the other thing that we've been hearing for over a month. It's the Delta variant and it's kids that are causing the surge. That's what we've been hearing over and over and over and over and over again. It's been the mantra from the governor's office, it's been a mantra from the press, it's been a mantra nationally. So this is the cases since the beginning of April of last year. You'll see that you see a spike on the left-hand side. That was our first wave. Now, it's so low because we had no testing back then, if you recall. So the cases are, you know, as anyone would probably tell you, the cases were higher than the one at the end of the year when we had a lot of testing because we had no testing. So you had a spike, you had another spike, then we actually had a third surge in April, May. You see that little hump? And now we are actually in the middle of a fourth surge. You see how much lower that surge is? So this mimics a lot of things in nature and in science, the dampening of vibration in a bridge, flutter in an airplane wing. You throw a ball up and bounce, you'll see the same kind of graph. Anyone who's had you know, some basic science have seen these kinds of graphs before, and that's exactly what's happening here. This is a virus, you know, running its cycles. Okay, so it's a fourth surge. It's less than the others, and like I said, we're well into it. It is also much less impactful. For example, what we were told yesterday in Chicago, the deaths per day on the first surge was 50 a day, then it was 25 a day in the second surge, third surge it was 7 a day, and now it's 1 a day in Chicago. So flip to the next slide, which shows cases, or shows daily deaths. Now you see what happened there. So as you can see, what's happening right now, and that's you know, because of everything we've learned. It's because of vaccinations, it's because of a lot of things, and it's also because what we haven't had. So we've had numerous strains. We've had an alpha variant and I think a gamma variant. There's been all kinds of variants. This is not the first one, but we've had no strains which the CDC would call a strain of variant of high consequence. And that is when there's clear evidence that prevention measures or medical countermeasures do not work as well on curbing the virus compared to other variants. Variants of high consequence are not easily diagnosed, significantly reduce the effectiveness of vaccines, or have a high number of vaccine breakthrough cases and aren't easily treated. That's not what we're having here, and that's not what we're seeing, and that's not what typically happens with as you get variants. We're going to have variants of COVID for the rest of all of our lives, like we have variants of the flu. We are going to have more variants. Something we have to learn to live with. And remember, this was all done to flatten the curve and protect the healthcare system. Our hospitals are not at risk. For example, here locally, we have 2 Silver Cross and Payless Hospital. There's 1 person in the ICU bed in each with COVID. That's it. And even yesterday in our mayor's caucus briefing, the hospitals are not at risk. No one's saying that they are at risk. So the question is, if this was all done, these mitigation factors were all to keep the hospitals from being at risk, and the hospitals aren't at risk, why are we taking more mitigation measures? So I go back to that, we're doing this to protect the healthcare system. Flip to the next slide. Here in Orland Park, we're doing really well. As far as all residents, 61.3% have completed their vaccine completely, 71.2 have a minimum of 1 dose. I don't know why the suburban Cook County numbers are what they are, because that doesn't make any sense. But my guess is because in the past suburban Cook County has been lower for their completed vaccination, that they have a data glitch on their site. But one thing that you have to factor in, that's all residents. You can't even get a vaccine if you're under 12. That's a big portion of our residency. So when you strip that out, 86% of all of Orland Park have had at least 1 shot of adults, and 73.2% have completed the vaccination series. So we've done really, really well here with that. And I'm glad that we've cut the red tape to make the vaccine available, especially for those who are most vulnerable and those who are most severely at risk. I also understand that some people have concerns about taking the vaccine, because it is, after all, an emergency use vaccine. It hasn't been fully tested like all vaccines are, so I get that. My suggestion is that everybody talks to their doctor and makes the decision in conjunction with their doctors, the person who knows them best, and then make your own personal decisions. Okay? But here in Orland Park, we've seen this number, and that's been very, very helpful, and it mitigates, doesn't stop all transmission. It's only 95% effective, but it also clearly has been reducing the hospitalization rates, or helping to do that. It's at least one factor. Flipping to the next slide. So Cook County cases by age. Now this is since the beginning, and you can see how high children are in that case thing, almost as high as 50 to 59-year-olds, certainly higher than 60 to 60 than all of our elderly, and that's because there's so many children. There's double the amount of children in the under 20 as there are people in all the other age groups. Okay? If you look at hospitalizations by age since the beginning, you see the numbers that you see, and that is clearly that it's much more likely to be hospitalized if you're over 50. And those rates are down below. So you can see it just continues to climb as you get older and older. All right. Again, thankfully we authorized the vaccine because that's really helped those on that right-hand side of the second slide there, and the hospitalizations really helped drive that down and protect our elderly. So that's pretty important. Flip to the next slide. Now we've been hearing for over a month that this variant and everything is about kids, and kids are hospitalized at a higher rate, and kids are driving this, and kids and kids and kids. We've made the kids the boogeyman here, okay? And culminating by Wednesday, we have a mask mandate for schools. Nowhere else, not at Guaranteed Rate Field, not at Lollapalooza for sure, not at United Center. I was inside the United Center for concert. None of those places. Nowhere else, not here, nowhere else have we had one. Here's the truth. This is from the Cook County website. From 6/29 through August 5th, so 37 days, this is the amount of cases and the amount of hospitalizations by age. It doesn't look to me like that's being driven by kids who are under 20. I think it speaks for itself. Flip to the next slide. So over the last 37 days, if you look at it on a rate basis, so per 100,000 population, the case rate for children is half of the next highest group. It's 70 to 79 or 12 times higher. Hospitalization rates, 2 per 100,000 for kids, and going up the line, up to almost 80 for people who are over 80. So the facts are that this being driven by children is not a fact. These are facts from the Cook County Department of Public Health website. It's not about the kids. Why are we making mitigation factors about our kids? That just, to me, doesn't make any sense whatsoever. Flip to the next slide. So, since the beginning of this, we know that the mortality rate increases dramatically with age. This is Illinois cases by age, and you see that kids are the second highest group there in total cases by age in the state since the beginning. So it's always been kids get it a lot, but we don't see it's almost negligible how many deaths, and that's with COVID, not necessarily from it. It's one of the factors. So that's since the beginning. Okay. Go to the next page. Another important thing to remember is we target children, and we're making children. Remember, we made them the boogeymen way back when, that they're going to spread it and kill grandma and grandpa, so they have to stay locked up and they can't go to school. Okay? These are facts from the CDC. That's for children 17 and under. Okay? COVID in the last 18 months, 349, where COVID was a contributing factor. They had COVID basically when they died. It doesn't say they died from it, but contributing factor. 477 in the last full one-year flu season died from the flu. H1N1, it was between 890 and 1840. And we didn't do any of this for that. And that was 5 times more deadly for children. But here's the kicker. The last year of fully available data, the suicide is the second leading cause of death for 10 and 14-year-olds and 15 to 19-year-olds. In total, over 3,000 a year. Almost 10 times what COVID is. And we're taking these actions to kids. We locked them out of school for a year, and now we're forcing them to wear masks. Why are we doing this to our children? This makes no sense.